This is a pelvic ultrasound of a 35 years old fertile female with the history of menorrhagia. We are seeing, I am showing you the longitudinal section and trying to get the uterus. Now this is the urinary bladder, and this is the longitudinal section of the uterus, measuring 6.2 by 2.6 centimeter. Being Paris, the size is though within normal, but low limits of normal. Now this is the endometrial canal, and this is the uterus. Okay, then this is the cervix. This area is representative of cervix. This is the vagina. There is a solid hypoechoic mass seen posterior to the uterus, and then rather pedunculated, I will say, it extends posteriorly into the pelvic cavity from the uterus, measures approximately 8.5 into 4.1 centimeters. Now I have picked this space. Let me explain you the fibroid. This is the fibroid, hypoechoic totally. Now why it is solid? Because we do not see any posterior wall acoustic enhancement, and secondly, we can see the posterior wall of this mass or a fibroid. Clearly we can see that. So this is the longitudinal section, and in this we see this hypoechoic mass with no internal calcifications and any other finding. It's very well demarcated. See, it's very well demarcated, and this is the endometrial canal. Does it spare the endometrial? Yes, it spares the endometrial canal. See this. Now, this is a better view of the uterus. This is the uterus, measuring 6.0 by 3.3 centimeters. This is acceptable. This central fluid-filled area is suggestive of endometrial canal, and we can see the posterior wall of the uterus clearly in this view. And this is the fibroid. So, having defined the uterus, when I move the probe, now this is the longitudinal section, and when I move the probe towards the left side of the patient slightly, I get this fibroid or a mass. Okay, now this is the longitudinal section. Keeping the probe, a picture of the uterus in the center of the screen, I am going to give a 90-degree sweep to the probe in transfer section to get the transfer section of the uterus, and here I get it. This is the uterus, measures 3.7, it's okay, and this is the endometrial canal. This is part of the fibroid, posterior wall of the urinary bladder. So this is another case of, now when I was initially scanning, what I want to tell you is that at times we have to use a light pressure, at times we have to give some pressure to the transducer to get the image. Now first, if I give a little pressure and now I'm doing this with pressure on the transducer, it really becomes difficult if I just confine to this view. Where is the uterus? Can't see that. Can't see it. Only when I hold the probe here do I get the uterus. And this is the uterus, and this is the fibroid. This is the urinary bladder, the uterus in longitudinal section, and the fibroid. And with clear central, this is the clear central, very early proliferative phase endometrial canal in this view. So this is in fact how we scan for the fibroid in case if it is there. Now let's see it in the adnexa. This is a small cystic area seen relating to the right ovary, measures approximately 4.2 centimeter by 2.3 centimeter and is consistent with a simple, uncomplicated retention ovarian cyst on the right side. What's the status on the left side? This is the left side. Now this is a mistake that can be easily made in longitudinal scan. You see, when I move the probe towards the left side of the patient, I get this. But on the image appearing on the right side, the cystic area. Never give your opinion regarding the location of the cyst. In longitudinal view, always get the transverse and then move the probe spirally, and you will see the cyst is in fact relating to the left ovary and not the right ovary. And on the right side, you don't see any such structure, and the trick is that you take the transverse section of the urinary bladder, move the probe towards the right side, angle it spirally, and try to get the iliac vessels. These are the iliac vessels, and this is the ovary on the right side. And this ovary is unremarkable. So this is another case of the day relating to the fibroid of the uterus, that too of the relating to the posterior wall, posterior myometrium, and extending into the pelvic cavity. Thank you very much.